Welcome back, everyone, to the deep dive. This time we're taking on the youth mental health crisis.
Oh,
We always say that,
yeah.
and we really mean it. We're not just looking at the headlines today. We're really trying to get deeper. And this
Mhm.
time we're diving into a really interesting article from the Stanford Social Innovation Review. It's called Promoting a Culture of Caring in Education.
Great article.
And it focuses on the JED Foundation and all the work they're doing. Most of you probably already know the stats, right?
Right.
Like teen anxiety and depression, they're way up. But
Absolutely.
this deep dive, it's not about, repeating all that.
No.
What's really fascinating here is how the JED Foundation, JED, is really approaching this problem.
Yeah.
They're going way beyond just, offering counseling services. They're actually trying to build
Mhm.
a culture of caring, which is
Yeah.
this systemic approach, and that's key,
Well,
to really make a difference. Think of it this way. Imagine, a college campus, it's like an ecosystem.
right. And Jed's not just, trying to treat the sick trees. They're looking at the soil, the sunlight, the whole forest.
I love that. That's such a great analogy.
Yeah.
So, so where does JED even start with something this big? The article mentions that they were inspired by a program
Okay.
used by the U.S. Air Force.
Interesting.
That seems like a pretty unusual comparison for college campus.
It is. It is surprising.
Yeah.
But JED noticed that the Air Force,
Mm.
they were really successful at reducing suicides and violence.
Oh, wow.
And they created this thing called a culture of caring. And they realized that college campuses and military bases, they actually have some things in common. They both have
Same.
these distinct structures and cultures.
But colleges are obviously a lot more diverse,
Oh, yeah.
way less hierarchical than a military base.
Absolutely.
So how did JED bridge that gap?
So they created this really flexible framework. It's called JT Campus. And it guides colleges through this 4-year partnership. And it all starts with an assessment. They look at, the mental health resources the campus already has. And they really try to get a sense of the culture, what's going on there. And then JED helps them develop a strategic plan that's customized for that particular campus.
So it's not a one-size-fits-all solution?
Absolutely not.
Okay.
That's one of the things that makes JED's approach so unique. I mean, every campus has its own challenges and its own opportunities. So they work collaboratively with the schools.
Yeah.
They provide support and coaching throughout the process. It's a real partnership.
This sounds very hands-on.
It is.
So what are some examples of things that JED actually helps colleges implement? Like, what are they actually doing?
It's a wide range. I mean, it can be very practical things, like, let's say, expanding counseling center hours or, maybe setting up a 247 crisis hotline. But they also do these broader initiatives, like training faculty and staff to recognize the warning signs
Right.
or creating peer support programs.
Hold on. Training faculty. I mean,
That's a big one.
that seems like a whole other beast. Aren't professors already overwhelmed? Like, how is that even possible?
It's definitely a challenge. I mean, faculty are busy,
Yeah.
but JED emphasizes that, faculty, they don't need to become therapists. It's not about that. It's more about just raising awareness, equipping them with resources,
Mm.
empowering them to have, those initial conversations
Yeah.
with students who might be struggling.
Okay, so they're getting all this guidance, the support.
Right.
But how does JED know if any of it is actually working? I mean,
Good point.
how do you measure something like a culture of caring? That's got to be tough.
Yeah, that's where their commitment to data really
Yeah.
comes into play.
Okay.
They use this student survey called Healthy Minds to track progress and identify areas where intervention is needed.
The article mentions the survey goes beyond just asking about,
Yeah,
anxiety and depression.
it does.
What other kinds of insights are they gathering?
So they're looking at a range of factors like social connectedness, substance use,
Wow.
and even, perceptions of stigma surrounding mental health. And it's not just about how students are feeling. It digs into things like help-seeking behavior.
Interesting.
For example, they found that while students of different races reported similar rates of mental health challenges, white students were way more likely to actually seek treatment.
That's really revealing.
Yeah.
It sounds like this data allows them to really tailor their approach and address these potential disparities.
Oh, absolutely.
But I'm curious, does JED have any, hard data showing that their program is actually improving student mental health?
Yes. Their 2020 evaluation report showed that campuses that implemented more of the JED campus strategies saw statistically significant improvements in student well-being.
Oh, wow. Okay, so what kind of improvements are we talking about?
So students reported feeling less shame about seeking help. They had increased knowledge of mental health resources. And most importantly, they saw reductions in anxiety, depression, and even suicidal ideation and attempts.
That's incredible, but getting buy-in from the entire campus community, especially faculty, that's got to be a hurdle.
It can be.
The article highlighted two different colleges, Macalester College and the University of Tennessee at Martin, and they had very different experiences with JED campus.
Yeah.
What were the key differences there?
So at Macalester College, they had ample resources, and they formed these interdisciplinary teams to tackle their mental health strategic plan. Like, everybody was involved.
Wow.
Faculty, students, even public safety and building maintenance.
Really?
They really embraced that idea of, a collective responsibility.
So they went all in. What about the University of Tennessee at Martin?
They faced more challenges, mostly because of limited staffing and funding. And while they did make progress in improving communication all about resources and setting up a crisis hotline,
Okay.
some other aspects of their plan were harder to implement.
It sounds like that implementation gap you mentioned earlier. Even with a great plan, actually executing it can be tricky.
Right.
Did the article offer any insights into how JED is tackling this challenge? Like, how do they help schools overcome these obstacles?
So they're focusing on providing more targeted support and coaching
Okay.
to help schools overcome these obstacles. And they've also been working with policymakers to advocate for increased funding for mental health initiatives.
So they're thinking about sustainability from the start.
Absolutely.
They're taking a long-term approach, not just putting a Band-Aid on the problem.
Right. They're trying to really embed mental health into the very fabric of these institutions.
I love that. That's a great way to put it. But one thing that really struck me was the emphasis on engaging faculty.
Yeah.
It seems like such a critical piece of this puzzle.
Absolutely.
But how do you get buy-in from faculty who are already so stretched thin, and they might not even feel qualified to address these kinds of issues?
You're right. It's tough. But JED provides resources, like they have this faculty guide to supporting student mental health. It offers a lot of practical tips and strategies, things they can actually do.
So it's not about turning professors into therapists?
No, not at all. It's about empowering them to be more aware,
Okay.
to notice the warning signs, to know how to connect students with the appropriate resources.
That makes sense. And what about JED's work beyond college campuses? The article mentions that they're now expanding into high schools and even working at the district level.
It's a natural progression. I mean, a lot of the issues that contribute to mental health challenges in college are already present in high school.
Of course.
Right. So by starting earlier, they're hoping to build a stronger foundation for well-being.
That makes sense. But high schoolers are a whole different ballgame.
Oh, yeah.
How are they adapting their approach for this younger audience? I mean,
They've realized that.
Yeah.
They've realized that a one-size-fits-all approach just won't work.
right.
There are like over 24,000 high schools in the U.S. So instead of, trying to target individual schools, they're working at the district level to implement systemic change.
Oh, that's interesting. That seems like a much bigger lift, though.
It is.
What does that actually look like in practice?
So it involves partnering with school districts to conduct these needs assessments,
Okay.
develop comprehensive mental health policies,
Wow.
train staff, and create these supportive school environments.
So it's about building that culture of caring from the ground up,
Exactly.
starting even earlier.
Yeah, starting even earlier in a student's journey.
And as always, they're taking that data-driven approach, right?
Absolutely.
Carefully piloting and evaluating their programs before scaling them up further.
Always.
That's good. It's encouraging to see that they're not just, throwing things at the wall and hoping something sticks.
No.
They're really committed to doing this right.
They are.
But I'm curious, what about the role of parents in all of this? Where did they fit in?
That's a great question. And it's one that JED is increasingly focused on. They recognize that parents are essential partners in this whole thing,
Yeah.
supporting student mental health.
Right.
So they offer resources and guidance for parents on how to talk to their kids about mental health,
That's good.
how to recognize the warning signs, and how to navigate the mental health services system, which can be really complex.
Oh, absolutely. So it sounds like JED is really trying to create this interconnected web of support.
Yeah.
Involving, students and faculty, policymakers, everybody.
It takes a village.
But given the scope of this crisis, can one organization really make a dent? I mean, it seems so overwhelming.
It is a huge challenge, and that's where collaboration comes in. JED is part of a larger coalition. It's called the Alignment for Progress.
Okay.
And their goal is pretty ambitious. They want to have 90% of Americans screen for mental health issues.
Wow.
90% of those in need receiving treatment, and 90% of those treated actually living full lives within the next 10 years.
That's huge. So it speaks to the need for a collective effort, right?
Right. Absolutely.
Yeah.
JED can't do this alone.
Yeah.
It takes schools, policymakers, families, communities,
Yeah.
and even students themselves working together to create lasting change.
That brings up an interesting point. The article mentions that JED believes students themselves can be powerful agents of change.
Yes.
Can you elaborate on that a little bit?
Well, think about it.
Mm.
Who better to understand the pressures and challenges facing young people than young people themselves?
Right.
So JED is increasingly focused on empowering students to be advocates for mental health
Okay.
in their schools and communities.
So it's about shifting from being, passive recipients of help to actually shaping the culture around them.
Exactly. And it's not just about mental health. It's about creating a generation of young people who are equipped to tackle all these complex challenges that we're facing,
Right.
like climate change, social inequality, political polarization, all of it.
Oh, it's overwhelming.
And all of those things require, empathy,
Yeah.
collaboration, and a deep sense of caring for ourselves and each other.
I love that. It's really inspiring to see how JED is working to create a more supportive and just world, not just for today's students, but for, future generations as well.
Absolutely.
But even with all the progress they've made, I imagine there are still challenges ahead, right?
Of course.
Mm.
As JED continues to grow and expand its reach,
Mm.
they're going to need to constantly adapt and innovate.
Right.
And one of the biggest challenges, I think, is ensuring that their programs are truly equitable and accessible to all students, regardless of background or identity.
That's such a crucial point. It's so easy to create programs that inadvertently benefit those who are already privileged.
It is.
How is JED working to address that issue?
So they're using the data from the Healthy Minds survey to identify disparities and tailor their interventions accordingly.
Okay.
And they're also actively working to diversify their staff and board to make sure they have a wide range of perspectives and experiences.
It sounds like they're really committed to making equity, a core value, not just an afterthought.
Yeah, it's got to be baked in from the beginning.
But even with all of JED's efforts, I imagine there's still a long way to go in addressing the youth mental health crisis.
Oh, absolutely.
What do you see as the biggest remaining hurdles?
I think one of the biggest hurdles is still stigma.
Yeah.
Despite all the awareness that's been raised,
Right.
there's still a lot of shame and silence surrounding mental health.
Yeah.
And that can prevent young people from seeking help or even just talking about their struggles.
That's so true. I mean, we have come a long way,
We have.
but there's still this perception that mental health issues are a sign of weakness or something to be ashamed of.
Absolutely. And that stigma can be particularly strong in certain communities or cultures.
Of course.
Right. So JD is working to address this through public awareness campaigns and by partnering with community organizations to create more culturally sensitive and relevant resources.
It seems like it's about meeting people where they are,
Exactly.
understanding their unique experiences and challenges.
You got it.
But beyond addressing stigma, what other systemic barriers need to be overcome?
Access to affordable and quality mental health care is still a huge problem.
It is.
There just aren't enough mental health professionals to meet the need,
Wow.
especially in underserved communities.
It's like we have this whole system that's set up to react to crises instead of preventing them in the first place.
That's exactly right. And that's why JED's focus on prevention and early intervention is so important.
Right.
By creating supportive environments and equipping young people with the skills and resources they need to thrive.
Yeah.
Hopefully we can reduce the need for crisis intervention down the line.
It's a long game,
It is.
but it's a necessary one for sure.
Absolutely.
The article ends by drawing this interesting parallel between JED's journey and the challenges facing higher education as a whole.
Oh, yeah.
Can you unpack that a little bit for us?
Sure. Universities are facing declining public trust
Oh, yeah.
and increasing pressure to prove their value, beyond just imparting knowledge.
Right.
They're being challenged to show their relevance in addressing the complex problems of our time.
Mm-hmm.
And that includes the well-being of their students.
So it's not just about academics anymore.
It's not.
It's about the whole student experience, including their mental health and well-being.
Right. And just like JED was challenged to become a change organization,
Yeah.
universities are being asked to do the same.
Interesting.
They need to move beyond simply being repositories of knowledge and become active agents of positive change.
That's a tall order, but it feels like a necessary evolution.
I think so.
I mean, we're living in a world that demands more than just knowledge.
It does.
It demands action and compassion and, a willingness to tackle these complex problems head on.
Yeah, you got to roll up your sleeves and get to work.
So that's why JE's work is so inspiring.
I agree.
They're showing us that it is possible to create a more caring and supportive world.
It is.
One campus, one district, one student at a time.
One step at a time.
And that's a powerful message to leave us with.
It is.
But before we wrap up, I want to go back to something you mentioned earlier about empowering students to be agents of change themselves.
Yeah.
What are some concrete examples of how JED is actually doing that?
One example is their work with student advisory groups.
Okay.
They bring together students from different campuses
Mm-hmm.
to give feedback on JED's programs and help shape their advocacy efforts.
So it's about giving students a seat at the table, letting their voices be heard?
Absolutely.
Yeah.
And they also provide training and resources to help students become mental health advocates
Wow.
in their schools and communities. So this could be anything from organizing awareness events
Okay.
to lobbying for policy changes.
So it's about giving them the tools and the confidence to make a difference.
Exactly. And it's not just about fixing immediate problems.
Right.
It's about equipping them to build a better future for themselves and their communities.
It's about fostering a sense of agency,
Yes,
giving them the belief that they can actually make a difference.
that's what it's all about.
Yeah, it's like that old saying, give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime.
Right.
But in this case, it's about teaching young people to advocate for their own well-being and the well-being of their communities.
It is. It's a beautiful analogy.
Yeah.
And it gets at the heart of what JED is trying to do. They're not just providing a service. It's more like they're fostering a movement.
This deep dive has been so eye-opening. It's so much more than just, providing counseling services.
It is.
It's about changing attitudes, building systems, empowering young people to be part of the solution.
And it's about recognizing that mental health, it's not just an individual issue.
Right.
It's a societal issue.
Yeah.
It's about creating a world where everyone feels supported and valued, where they can, thrive and reach their full potential.
I love that vision.
Yeah.
It goes beyond just fixing problems, it's about building a better future. And what's so inspiring about JDD's story is that it all started with a simple question. How can we prevent this from happening again?
That's it. That
Yeah.
question,
Yeah.
born from tragedy, it sparked a movement that's changing the lives of countless young people.
It's amazing.
And it's a question that each of us can ask in our own lives
That's true.
and in our own communities.
What small acts of caring can we do today?
Mhm.
Things that might ripple outwards and create a more just and compassionate world tomorrow.
That's the challenge.
Yeah, I think that's a powerful note to leave our listeners with.
I think so too.
Because creating a culture of caring, it's not just the responsibility of organizations like JED,
Right.
it's the responsibility of all of us.
Well said.
Thanks for joining us on this deep dive. Until next time, keep asking those tough questions, keep seeking those inspiring stories, and keep diving deep.